Hi there, Dr. Andrea Schnowske from Health and Horsepower. And this week I want to talk a little bit more about how chiropractic can actually help improve digestive function. So we have bones stacked on top of another. We've got a cartilage disc in between and a hole, which is where your nerves come through. If we have arthritis or if we have degeneration of the disc between the bones, what can happen is we'll actually see where as that disc breaks down and we get arthritis formation, the hole where the nerve comes through is going to have some sharp bone spurs that can actually irritate and damage that nerve and not allow it to work properly. And that can also affect not only how your organs are functioning, but also it can cause damage where that organ is not getting the proper signaling. So a lot of times when I have patients that are coming in my office with digestive issues, I always want to make sure that their nerves are working properly first. So the nerves in your mid-back, kind of right between your shoulder blade area, typically T6 is usually the joint that I'll see most issues with when it comes to stomach function issues. A lot of times I can see issues with heartburn or reflux or GERD, and a lot of that can be in any age. I've seen babies with GERD and reflux issues as well as older adults as well. But if that nerve that goes to your stomach isn't working properly, we may not have the proper function and movement of the muscles in the stomach. And we can also have less mucus and less acid production in our stomach that can cause stomach pain. It can cause heartburn and cause issues with GERD. So it's very important to make sure that the nerves going to the organ system are working. I usually take it a step further. And in some cases, I also provide some herbal supportives to help get your organ system and get that stomach working better. So helping to regrow the lining, helping to improve the amount of acid and the quality of the acid that your stomach is producing so that you're digesting your food well. And then further down, we also have our liver and gallbladder function typically is around T9 area. Those nerves tell your liver to function, to produce bile, to help you break down your food. We also have pancreas function in that same area as well. So if we're having digestive issues, a lot of times we may have an issue in our spine where the nerves going to the stomach or the liver or the gallbladder or the pancreas aren't working properly, and we're not getting the proper digestive enzymes to help break down our food. Eventually, what can happen is when we have digestive issues for a long time, we can start to see where there's damage inside of the intestine. And what tends to happen is we get irritation in the stomach, and sometimes that can even throw off where we're getting like bacteria where they're not supposed to be. So a lot of times we'll get bloating in the stomach. We can also get issues where we have a lot of gas, especially smelly gas or smelly stool. That can be an indicator that the bacteria balance might be off in your intestine. That's called dysbiosis. So a lot of times when I have patients that are having digestive issues, we want to sit down, kind of figure out where do we need to start? Do we need to check nerve function first? Are you seeing a chiropractor currently? Have you had that checked? I also like to talk a little bit more about where and what types of symptoms we're having with digestive issues, whether that's coming from the stomach or the pancreas or the liver or the small or large intestine, so we can really problem solve to see, do we need to do some testing first to see where you're at? Or do we need to take it back to square one and check everything? So very important to realize that chiropractic is not just for pain. Chiropractic also improves nerve function, and that nerve function can actually stimulate and help with digestive issues. So whether you're having stomach pain, heartburn, GERD, whether you're having bloating, whether you're having irregular stools, or whether you're having issues where things aren't quite moving properly through the intestines, chiropractic can help with that. So very important to realize that chiropractic is not just for joint pain. It's not just for pain relief. It's about improving function and improving your nerves and how they tell your body what to do. Okay, I want to share this with you because I think this is super important to understand how your body works, how it functions, and how it heals. So this book is by Frank H. Natter. It's an Atlas of Human Anatomy. We're going to go ahead and turn to the page for the sympathetic nervous system. So this goes through, you have two parts to your nervous system. You have sympathetic and parasympathetic. Typically, sympathetic is going to speed up and kind of stimulate, and parasympathetic is stopping flow and calming down. So if we look at our sympathetic nervous system, so these are the bones of your spine. You have nerves that exit at every single level, and those nerves actually communicate with all of your organ systems. So they're going to communicate with your heart and your lungs. They're going to communicate with your stomach and intestinal function, and also how our muscles help push things through through the intestinal system and out when we're voiding. So very important to understand that when we are looking at overall body function, anytime we have an issue with our spine, so whether you have an issue in your thoracic spine or the lower thoracic or upper lumbar spine, if there's nerve pressure going on here, that nerve pressure can cause those organs not to work properly. And then we also have the parasympathetic nervous system. So for this one, we have typically the nerves that are going to relax muscles, slow things down, open up all of those pathways so things can digest all the way through. So if you're having issue with organ function or relaxation, so if we're having issues with either contraction or relaxation where things are tight or not stimulating, that may be due to nerves that could be compressed in the spine affecting those organ functions. I think this is really neat too. So this is a kind of a breakdown of the sympathetic nervous system. So this shows your spine over here, those nerve ganglions where those nerves kind of come together, and then all the different organ functions that are affected if we have any nerve pressure. So that literally affects your whole entire digestive system, cardiovascular, pulmonary, you name it, it's there. And we also have our parasympathetic. So this is going to be, like I said, the other side of that nervous system. So that's going to be for some of your glands. That's going to be for stimulation as well as relaxation of a lot of our organ systems as well. So really important to understand that you have two parts to your nervous system, telling your body what to do, how to stimulate, and also how to relax.